human cost, because the government has followed the advice of our medical experts and acted quickly to stop this disease spreading and killing large numbers of Kenyans. Indeed, at the beginning of the pandemic, our medical experts had estimated that if we had not taken action, they had projected 10,000 people would have been infected by the end of April. However, due to determined mitigating measures, both by the national government and our county governments, we are now only at 343 confirmed cases, and I want to take this opportunity to thank the millions of Kenyans for showing discipline and responsibility, because it is this attitude by law-abiding Kenyans that is saving thousands of families from grieving for those who would otherwise be lost to the coronavirus. Indeed, on behalf of a grateful nation, I also take this opportunity to extend our appreciation and thanks to the many thousands of health and security officials standing on the front lines against this most formidable foe. Indeed, while we continue to mourn the 14 who have succumbed to the disease, we also celebrate the 98 recoveries that we have seen so far. I am encouraged by the progress we have made, but I wish to remind Kenyans that we are yet to be victorious. And that is the reason why today I wish to announce the following additional measures. In accordance to the advice given to me by the National Emergency Response Committee on the coronavirus pandemic, the National Security Council has sanctioned the following additional measures to protect lives and to protect our country. That the cessation of movement into and out of the Nairobi metropolitan area and the counties of Kilifi, Kwale, and Mombasa that are currently in force shall be extended for a further containment period of 21 days. That the nationwide dusk to dawn curfew that is currently in force shall also be extended for a further period of 21 days. And to ensure that porous borders and security threats do not compromise our response to this pandemic, the security services will upgrade their alert and response measures in every border area. Additionally, the counties of Mandera, Kilifi, Kwale, and Mombasa have registered through their governors an increase in cases of infection and have reported this. And today we say that if this worrying trend does not reverse, more stringent measures will be taken in consultation with the respective county governments. I will continue to use the best scientific and medical advice to calibrate our response as a nation, and we shall escalate, or for that matter, de-escalate, on the basis of how vulnerable we are to large-scale infection. Key to making these determinations is our progress with targeted mass testing, and we are working hard to overcome the greatly constrained global supplies of testing equipment in order for us to expand our capabilities nationwide. Fellow Kenyans, I am indeed profoundly conscious of the economic and livelihood distress many Kenyans are feeling at this particular moment. And this is why we are going to continue to roll out initiatives that offer relief, particularly to our youth and our families in distress. The next initiative, of which will commence on Wednesday, the 29th of April, is an initiative that we're calling the National Hygiene Program. And I believe that this is an initiative that will create jobs while making our environments healthier. The first phase of the National Hygiene Program for the next 30 days will employ some 26,148 workers and eventually grow to over 100,000 young people across the country. This added to the already existing 108,000 vulnerable households that are presently receiving direct cash grants, and the 8 billion Kenya shillings that our senior citizen program and vulnerable families are getting, which I believe will continue to offer tangible relief to the most needy in our society. The inaugural cluster of employment in the program that I have just announced, the National Hygiene Program, will involve residents in 23 informal settlements across 7 of the most affected counties. To demonstrate the principles of this approach, the making of face masks will be undertaken by 4,048 tailors residing in these settlements, and for their neighborhoods, they will make up to 250,000 masks per day. This intervention, I believe, stimulates the local economy while advancing the war against coronavirus. We have also decided to move in phases to ensure that those being employed work under proper health standards and protocols that will help us limit the rate of infection. Indeed, as we get better and more practiced at implementing work protocols, we will increase the amount and number of people employed. As this phase is rolled out from this Wednesday, phase 2 will be getting prepared. Its scale will be much greater, and its area of focus will be nationwide. Additionally, there are already aspects of the post-coronavirus economic recovery plan that we are progressively rolling out. And my administration shall in particular activate micro, small, and medium enterprises across our country to manufacture basic medical equipment and supplies for domestic use and for export. This initiative, because we do believe we shall defeat the coronavirus, shall be nested under the universal healthcare coverage agenda and will utilize approximately 1.5 billion Kenya shillings, and the Juakali sector shall take the center stage in production while leveraging on our technical and vocational educational training centers, as well as the constituency industrial development centers. And to this end, I do direct our Ministry of Health and the Ministry of Industry and Trade to expedite the rollout of this initiative across the country, and I do encourage our governors, to whom health is one of their key roles, to please help us and support us in supporting these young men and women working in our SMEs.